Thank you. Good morning, everybody.
Good morning.
I thank you so much for being here. I thank our panelists. I thank the Bronx Health Reach for sponsoring this town hall meeting this morning. It is so critical and it is so important. And this morning I am thankful for this opportunity to be able to stand before you and to give to you a brief portion of my experience with the healthcare system. A few years ago, I did not know it at the time, but I know now today that I am a diabetic. And at one point in time in my life, you wouldn't tell it today, but I used to be 283 pounds. I used to wear a size 52 suit, and I was getting ready to go into a size 54 suit when my life changed dramatically. Within a month's time, I went from being 283 pounds down to 195. And I want to let you know today, I want to be very clear about that. I was not on any kind of diet plan. I was not trying to lose weight. This happened all within about 30 days. And during that time, I was very sick. Oftentimes, I couldn't get out of bed. Many times, I was unable to eat. I was very weak, very sick all the time. And during this experience, I've been going back and forth to the various hospitals here in Bronx County, trying to seek out some help and some answers as to what was happening to me. And all of the time, they were sending me back home, telling me that everything was okay, everything was all right. And during this process, at the same time, I experienced a paper cut on my finger. And this paper cut, which a paper cut usually gets better within a matter of a couple of hours, each day, this paper cut for me got worse and worse. It was so bad that my finger became infected. And of course, this also caused me to go back to the emergency rooms to seek out some answers, to seek out some help as to what was going on with my health. What was going on with my finger? Why was my finger not healing? Why was this paper cut getting so out of control? And as I went back and forth to the emergency rooms, as I went back and forth with their then signed me to an outpatient clinic, even in that process, I could not get any answers. And one of the reasons I discovered why was because every time I went as an outpatient to one of these clinics, I saw a different doctor every time. Someone who did not understand my situation. But today I am very thankful that I, even though I was going through that difficult time, was not getting any answers from my healthcare, what I thought my healthcare professionals, and at a time when I lost all hope in the healthcare professional, I am thankful that I met someone, a doctor, who addressed my concerns, let me know that my problem was that I was a diabetic, number one, and begin to treat my diabetes and help me to get that under control. And as a result, my finger healed and I did not suffer any amputation, and that I am so thankful for. So I thank you for this opportunity for allowing me to share a brief portion of my testimony.